So we're going to open it for questions from the audience. Thank you, Rudy. Thank you, Sheana. No questions? One question.
So my name is Deanna Pineda from Vuela for Health. And I think it's no more that question is to say thank you very much, Rudy, for all this explanation in the better words that we can do it. So Vuela for Health is a non-profit community organization. And to give you an example, we have many, many programs about prevention on health. But one of the areas of Vuela for Health is to empower the women. We are working with the Spanish speakers more, and this group have an idea to put a conference together. We want to have a conference of 150 women that is going to talk about how we can empower them, how we can be this voice, and how... Yes, thank you.
Yeah, it's too close.
Okay.
Diana. Diana.
Yes, and how we can do the best for our families. To try to find funding for this one, it's very impossible. Why? Because when we go and say, can we have $2,500 for a conference for 150 women, the first question is, we have a budget for kids, but not for moms. This is going to be in Spanish, so are you sure that they are residents? So how, if in the statistics that you show us that more than 51% of our kids coming from a parent that is immigrant, how do you think we're going to have a better life for them if we don't give the education, the support to the parents? So this is really ridiculous, but this is the way that sometimes it's really, really difficult to find funding to give education to the parents that want to empower their families and do the best. So whatever you can do, please do it, because it's a big, big need that we really need your support. Thank you, Rudy, again, and I'm proud to be part of collaboration with Servicios de la Raza and with all of you. Thank you.
Well, no question but what she said.
Thank you, Deanna, for your comments.
Hi. I just wanted to raise a question to both Sheana and Rudy. I work with a community-based participatory research organization, Taking Neighborhood Health to Heart. We've been doing work for the last 11 years in Northeast Denver. And my question is, can you both speak to when the community and academia are doing research, who holds the data and how do you hold it? It seems during this time period that Zuckerberg is making his presentation before our congressional folks that the question of security of data and the access that community has to data seems to me to be very important, but a lot of times that condition of who controls the data is not thoroughly discussed. So could you both speak to that?
I'd be happy to. Can you hear me? Is this on? So I agree completely, Patty. Thank you for raising that. I think it's something that we need to keep at the top of mind. It hasn't always been. And these are really critical questions. I would encourage every one of you to read The Immortal Life of Henrietta Lacks if you haven't already. It's basically a lens on all the things that might happen if you don't take really good care to ask and answer these questions up front. Whose data are these? How are they being protected? What are you going to do with them? Who has the right to share them? Who gets to give authority? Who gets the benefit if there's some real positive outcome from sharing your data? Are your communities going to be impoverished while academic or other entities get enriched from some of these activities? So I think those, I don't have answers except to say you have to ask the questions and establish the protocols for data ownership and privacy and confidentiality, and then benefit up front and I'd like to see it get more attention. Yeah.
So, and to answer your question on that, as a self-determinant, autonomous, community-based organization, we want to control our own data. But this is where academia can come in and help us build that capacity to keep it private, to keep it secure. I mean, we're a mental health service. We're an MA site. We're already controlled very heavily by HIPAA. We understand it. That's how we work. But again, getting the IT capacity, software capacity to control our own data and share it with academia. But doing it from a community-centric perspective, correct? And how is it going to improve our communities? And if it doesn't improve them, why are we doing the research? Or why are we participating?
One last question.
Hello, I'm Maria Zubia. I have a question, and I guess I'm just, over the years, have been wondering really the academic versus reality piece that I see in our communities. I've been working in my community. I actually live and I grew up there and I work there. And for the past 17 years, I see this disconnect between academic and reality. And so my question has always been, kind of like you said, Rudy, is do we do these research or participate in these research projects really for the benefit of who we're serving? Who is it benefiting whenever you come to CBOs or community-based organizations to do research? Is it really to benefit, to make a change systematically so that people can go through those systems, flawlessly, hopefully? Or is it really for funding? Is it really for best practice so that we're all limited once again? Because, best practice, everybody uses that language whenever you have to write a grant. Are you using best practice? Well, is that coming from this research? And because, all our communities, none of them fit in a box. I mean, let's just say it. Everybody is different. Every community is different. So what really is the purpose of continuing to do the same thing over and over? For me, I am not a data person. I am not numbers. I'm not about data. I'm more about the lived experience. To me, you talk about lived experience. You talk about somebody who can help navigate someone else through those programs, kind of like you said, Rudy, as well. You hire people from within the community. That makes more sense to really invest in the community navigation model that a lot of us utilize, because that's where it's at. They're helping people get to where they need to be. There's a need. Let's help them get to that need and help them, get whatever it is that's going on fixed. But in the same sense, we're not really doing a service to anybody, because in the end, those people who have the powers to be to make these changes on these at a systematic level are not seeing the full story, because they see it from a researcher or from an academic point of view, but they're not seeing it from the lived experience and from the people who are truly going through it. So how do we change that? How do we make it more effective so that it truly is impacting the communities that we're here to serve, and it's not really, promoting more of the same? Because how many years have we gone through this? How many years do we know that you don't get a grant for a certain reason? And it's all like a cookie cutter approach when you have a common grant application for the whole state. What does that tell you? That tells you that everybody's looking at the same thing, but our communities aren't the same.
I think that's a really important point. I would encourage you to recognize your own value and make the demands of people that want to partner. The other, and so really ask those hard questions when people come to you. What is it that's in it for my community? How is this going to be different than it's been before? What are things that we can do together to improve it? I want to just point to one thing that's going on in the state. Rudy mentioned the 1 penny, and that 80 cents of it is 80% of it is going to California and 20% is here, and then what a small proportion of the state foundation funding is going to Latino-related issues. They've been part of, it's the Latinx Collaborative, is that what it's? Collective. And that's the other thing I would suggest, is get together and create consortiums or create collaborations across multiple agencies to gain more power and more visibility. This is a group that's gotten together to raise awareness of this critical lack of funding issue for Latino community organizations and Latino serving organizations. So it's a group of 10 community organizations. Why don't you talk about it?
It's called the Latinx Collective. We've been doing this work for 2 years, brought 8 agencies together that have over 411 years of impact and service collectively to the Latino community, the Latino founded, led, serving, hiring, governed agencies that came together, and Servicios sponsored the research and the data crunching around the philanthropic Native Foundation giving of over 42 foundations across the state, and we pared it down to the top about 12 to 13 givers. We are now in a small work group being led by Mr. Carlos Martinez up there, the Latino Community Foundation. Hello, Carlos. And I'll see you this afternoon. And we are working with 3 small rural community-based organizations, Western Slope in the Valle de San Luis, also Northeastern Colorado, and a small working group of 3 urban corridor organizations to develop a statewide funding initiative around general operating support and capacity building. And we do have the ears, and we have been funded by the 3 top foundations to do this work. So thanks, Dr. Bull. So we're working on it. We know there's a problem. We've known this for many years, and we started working on it 2 years ago, Maria. So give me a call, and we could talk about it.
Thank you, Rudy. And thank you, Sheana.